This proposal comes with recommendations to delete filled positions in 90% of the 365.6 FTEs. They'll have a landing spot in another position in the same classification. Now, that to me is like gymnastics. To be able to find the folks the same classification, the remaining 10% will be offered another position in a different classification that they qualify for. The good news here is that people will have a landing spot. And not only because we want them and we need them, but because we want to make sure that we don't destabilize our system. We have stakeholders that are very invested in what we are doing. Obviously, some of them came and gave us their thoughts earlier in public comment, but there's also infinity groups that have a very vested interest, including our unions. And I would encourage you to continue to have those conversations with the unions in a way that inspires collaboration, because we created a lot of really goodwill with a lot of our stakeholders, including our unions, but all of the folks who are in the community who voted yes on Measure A that allowed for us to stabilize the system. And so I don't want to reduce any of that goodwill and collaboration simply because we are making cuts. I know we never said we're not going to. We said this is 330. We have $1 billion.
And I just wanted to share a couple things related to that. One is I don't usually share very many personal stories up here, but I'll just share one because I just want our employees to know how seriously I personally take impacts on staff. My wife works now for a school district, but used to as well. And when she was pregnant with our first child, she was laid off. And by laid off, I mean actually out the door laid off during that pregnancy at a time when we didn't otherwise have any health insurance coverage. This was pre-Affordable Care Act. We were on a high deductible plan. We were informed the plan deductible was going to, double to be $10,000. That was back at a time when, I was still in graduate school, and it was an extraordinary stress. And I just share that because we very much understand personally what it means for people to have uncertainty for themselves and their families. And you're right, it is gymnastics. And we work very, very hard. It is exactly why we have a hiring freeze, even though every department doesn't like it, even though I get lots of complaints about it. We want to do everything we possibly can to minimize impacts on our staff. And it is no accident that 90% of filled position impacts here are moving to a same classification. That means no loss in pay. That means no change in title. And even the remaining handful continue to have a job with benefits. It's very important to us. Now, we may not always be able to say that, but we can say with certainty we will try our hardest to be able to always say that. And that's a commitment that I personally have to our staff. I know it's something shared by every member of the board, but it's something we work really hard to do. And you're also absolutely right, Supervisor, that we had incredible community support and collaboration and partnership from our unions, from our stakeholders, from our CBO providers in passing Measure A. And we tried to be as transparent as possible. I don't know how many times we said, and we are going to have cuts even with Measure A. Measure A is essential, but isn't the panacea. And this is part of what we're seeing. We said many, many, many months ago that we were going to need to bring $200 million in ongoing budget solutions related to SCVH here at midyear. It was a front page article in the Mercury News many, many months ago. We've been talking about it. We are committed to continuing to do employee forums. You heard a speaker reference our CBO forums. We will continue to provide the best information we can. And we will continue every effort possible to try to mitigate those impacts, because at the end of the day, it is absolutely about vital services for the community that we serve. That's exactly why we're pushing on the state to do the right thing. It's exactly why we push departments to come up with the most creative proposals they possibly can to minimize impacts on those we serve, number one, and minimize impacts on the people who deliver those services, which is both our staff, but also we recognize many of our nonprofit partners too, who are heavily dependent on county funding. It is very understandable that people have concerns about any specific proposal. It's understandable that staff don't relish changing roles in the organization. That makes sense. We all recognize that. And we have to balance the budget. We have to do so in as strategic a way as we can. And we will continue to bring our best thinking and recommendations in front of the board. And as you heard at the last board meeting with SCVH specifically, they have really been pushing on solutions that don't involve positions. We're fortunate that the overwhelming majority of that $200 million is actually not based on position reductions or service reductions, but unfortunately it is a piece of things.
How are you reducing your overhead in a way that department is becoming more efficient, more effective? And whether it's purchases of materials or it's less consultants that you're having. Oh, we've already had a bit of a study session, but not including this budget conversation as in-depth as we're having today. So I would like to know, to understand exactly the locations and the impacts for the reassignments in your system, and that there isn't a concentration of staff in one particular district over the other, or if there is, it's because out of need. And I will continue to pipe up about South County and the need that is there. And simply because we're far away does not mean that we are not there. My people may not come all the way over here because that is a challenge, but they typically will call. We said we were going to commit to a three-prong approach where we were going to ask our residents to tax themselves, for us to look for additional grants, and then for us to create efficiencies. And so with that three-prong approach, I'd like to also, when we're receiving items that is structured in that way, that you're telling me some of the reductions that you're making, some of the improvements that have been done internally in the departments, how you're becoming more efficient, and then some of the sources of the grants. And I know we saw that somewhat in the mental health, but not completely. I think I like for us to continue with this three-prong approach and how we're actually moving things forward.
And I know you were not able to be here for the last board meeting where we had the SCVH study session, but included in that presentation were some very specific examples of what you're talking about. And let me just highlight a couple. Paul and the department talked about some of the initiatives to increase revenue and billing, such as the Revenue Guardian program, and how that's being utilized to actually increase revenues received in the health system, the utilization of looking at service lines and our enterprise system, taking advantage. And this was one of the strategic reasons also behind the acquisition of Regional Medical Center that goes beyond, obviously, number one, the direct service delivery at Regional, but some of the strategic pieces around thinking about what we can then do as a holistic system that Paul had walked through. And you'll see included actually here a number of those kinds of efforts. So for instance, included in the mid-year report, Paul mentioned this briefly, is actually the addition of some employed physicians and the elimination of contracted physician groups, because we actually now have some heft as a broader system to be able to bring some of that coverage in-house in a way that maximizes revenue and allows us to deploy resources more flexibly. Paul mentioned specifically the anesthesiologists, but there's a few others as well that are included in the recommendations here at mid-year. And Paul, I don't know if you want to expand on some other examples. I know there's a family residency example too, but the majority, not actually just majority, it's almost about 3/4 of that $200 million is actually the whole series of efficiencies, revenue opportunities, and related endeavors.
Approximately 38% of the $200 million is related to position reductions, a reduction in overtime usage, and so forth. So that represents 38% of that $200 million. Another $32 million, which brings it up to, in total, about $100 million, is related to services and supplies. So that's $100 million, approximately.
Can you
So-
repeat the supplies by percentage?
Let me just give dollar amounts. Approximately $68 to $69 million is related to positions. In other words, deletion of coded positions, filled or vacant, as well as a reduction in overtime. Service supplies is around $32 to $33 million in terms of reductions in some of the items, Supervisor Ellenberg, that I mentioned, whether it has to do with pharmaceutical supplies, other supply chain needs of the organization, where we've identified a certain percentage that we believe is achievable in savings, either through renegotiation of those contracts or through better management of that supply chain. The balance, to James's point, is all related to revenue improvement opportunities, either through revenue cycle improvements, right, making sure that we're collecting every dollar that we're due, denials management, et cetera. Another part of that is through operational efficiencies, in other words, seeing more patients in our primary care and specialty clinics, as well as in our hospitals. Because those volumes, if we're able to be more efficient, we're able to generate revenues to help cover our cost. As James has mentioned, we've proposed there are a number of different initiatives that will actually allow us to better manage the quality of care that we offer and improve accessibility to care. Let me give you a couple examples of that. James had mentioned that the proposal in the mid-year includes a number of P41s, physician provider support. And they come in the form of replacing contracted specialists in the hospital anesthesia. I mentioned hospitalists, but also a number of different specialties where we're having difficulties in contracting for coverage at Regional Medical Center at O'Connor Hospital. In order to have consistent coverage, it's better to hire our own physicians to maintain consistent coverage and to ensure that we're providing a level and the quality of care that I think all of you expect of us as a healthcare system. Those actually allow us to generate not only savings related to not contracting in the market, but also allows us to generate professional fee revenues in the care that we are providing both in the hospital but also in our specialty clinics. So we're able to generate revenues and provide more access to care. Another example is that Stanford has notified us that they're no longer going to support the family medicine residency program. And these are 27 residents, 9 residents per year, plus an additional 2 sports medicine residents. We know in our system we need primary care physicians, and we have to grow our own, and the family medicine program is critically important to our health system and to this community. Stanford has chosen not to support that program. They're not focused on family medicine or primary care. They're more focused on hospital-based services, internal medicine, and so forth. So what we've done is agree to take on that program because we actually see 2 things happening, not only relative to maintaining and growing our physician workforce in primary care, but also from a financial perspective, because the way in which we're modeled relative to our federally qualified health centers, we're able to generate revenues to cover the cost of the program and potentially see a margin there to help cover other services that we want to provide in the community. So that's an example where we're trying to strategically grow the system in ways in which we're better able to serve the community. Finding ways in which we can grow a workforce, hire physicians and staff that are reflective of the community we serve. we have the ability to match residents to our mission in this community as a healthcare organization. That's critically important. That is something that we have to start now because we're talking about not just challenges this year in terms of hiring physicians, but we're talking about 5 years from now, 10 years from now, having a workforce that's more reflective of the community we're trying to serve. We're trying to balance strategically during this time, financially how to offset the challenges that we have related to HR1, but also strategically grow the system in a way that it can be sustainable going forward.